Hello, the following is my presentation on the Family Assessment Project for N332 Health Assessment of Communities, Groups, and Families. Okay. I first want to start talking about the Friedman's Family Assessment Model. The Friedman's Family Assessment Model focuses on observing families' internal and external influences that affect family as well as wider society. Influences can include health, religion, school, and employment. This was all obtained from Robinson, Family Health Nursing Theory, Practice and Research, 7th edition. Some identifying information about the family that I decided to do. The Marsh family, that name is, of course, fake, after my favorite family of South Park. The information obtained is from an actual family. However, for privacy's sake, I would like to identify them as the Marsh family. The Marsh family unit focuses primarily on the parents and that household, Stan and Wendy Marsh. They have four children, their oldest being Roscoe, second oldest being Trinity, third Samuel, and then lastly Amaya. Um, they are an African American family. They speak English. Both of the parents were born and raised in Louisiana, as well as their children. They still live in rural Louisiana in a single family home. The family identifies as Christian, although they haven't recently gone to church on Sundays. They still maintain their faith and very religious by reading the Bible, and often praying at the home. The family can be considered working class. The father, Stan, is the primary breadwinner of the family. He works as a registered nurse at a local hospital. The mother also works as a licensed practical nurse, albeit at a hospital that's slightly further away. Attaches the genogram for the family. The attached eco map of the family can show various stressors, and things such as Wendy's work, external family, um, as well as strong relationships, and strenuous relationships. The arrows mark the direction of flow as it affects the family. According to the Duval's 8 stages, for the developmental level of the family would be in a stage 5, or families with adolescent stage. This is in part because mostly all of the children are in that teenage years, which would classify them as adolescents. This stage involves navigating the challenges of raising teenagers, which include fostering independence, while still having some type of control, just to maintain that guidance and support. In the event that something should happen, you always want to be there as parents, to kind of guide your children along, but you also want to give them a little bit of a rope so that they can kind of find things out on their own. This can present a little bit of an issue, especially in the event of Samuel, who is autistic, who's often clingy, who doesn't really want to venture out and learn new things, who would rather the comfort and safety of the family. This level was determined as all of the children, like I said, are in their teenage years, and many are focusing themselves on establishing in the world. Um, the fact that they have substance abuse and mental disorders and paranoid schizophrenia can also present to be an issue. This information, of course, was obtained from Robinson, page 44. Some environmental data about the family. So the family owns a 3-bedroom single family home where the parents occupy the master bedroom while the male and female children share the other rooms, males in one room, females in the other room. There is very limited space, very little room for privacy. However, the home does provide adequate resources, which include heating, cooling, lighting, vision, water supply, food, safety, etc. The lawn of the outdoors is well kept. There's a flower bed outside. There's space outside for the children to have kind of a space to recoup and regain composure with themselves. Um, there is space for that in the home, and the yard is very well kept. The oldest daughter did voice concerns about being a home person and not sharing space. Of course, with the limited living arrangements, that is somewhat impossible. The youngest male, Samuel, is attached to the older male child just because that's who he grew up with, that's who he's most comfortable with, and that's who he's lived in the room with for pretty much most of his life. The youngest daughter is quiet and isolated, minor interactions with the other children. The home appears slightly cluttered at times, rooms and personal spaces being the most cluttered, as well as the restrooms as well. Both parents work full-time jobs. Dad's always home in the afternoon. He works typically an 8 to 5 shift at the hospital, Monday through Friday. The mom works 3 days a week and usually work 12-hour shifts. The family displays very literacy involving healthcare just because both families are working in the healthcare field as nurses. The family understands the issues with the youngest daughter seeing a psychiatrist for management of paranoid schizophrenia, the youngest son seeing the behaviors for management of autism, while there are substance abuse issues with the older two, also management of Crohn's disease with the mother and daughter. The family does believe that they are taking positive steps to adapt to current health issues. Health insurance is obtained through the father's job where he works at the hospital and thus providing access to health care. All dental appointments are also maintained. Family stressors. So there are stressors to the family, which include ill-obtained habits, such as marijuana and the use of alcohol with the older siblings. The stressors of managing autism with the younger siblings, as well as the chronic paranoid schizophrenia with the youngest daughter, just making sure that she's taking her medicine, making sure that any type of episodes of schizophrenia is dealt with by the family and that everybody is kind of aware of how to deal with it. Of course, each of them are adolescents, and that comes with the struggles of fostering independence while maintaining safety as well. So, just trying to cope and deal with that as parents can be an issue. Job issues with the parents, which they're, like I said, very stressful in working with coworkers and working at their job as a nurse is often very stressful. So those job issues, which also lead to economic stressors because both parents do need to work in order to provide for the household. If one parent is stumbles, the other parent can step in and bear the brunt of it for a little while, but that, of course, isn't permanent. Both parents are definitely needed to maintain that household. Effective coping strategies, of course, include going to church, which the family doesn't typically do. However, they do attend online services as well as pray in the house to maintain their religious freedom and their religious mentums. Meeting with psychiatrists and doctors, behaviorists for the children, of course, is very effective coping strategies, relying on those outside resources to really tackle issues with chronic paranoid schizophrenia as well as autism and substance abuse. Um, while the parents don't approve of the substance abuse that did occur with their younger children, or with the older children, um, they do understand that additional help is going to be necessary in order for them to be able to find other ways to cope that doesn't include the use of substances. Some internal coping strategies does include the use of humor and relying on each other. You can see that the family is very jovial at times, often making jokes about each other, and often laughing together. And yeah, you can feel a sense of happiness for a time, but everybody kind of does understand that there are certain stressors and certain issues that need to be dealt with. And of course, they do rely on each other. Negative coping strategies that are seen include the use of substances, marijuana, and alcohol for things like managing stress and also managing what the certain family members believe as managing physical symptoms such as Crohn's disease. For the nursing diagnosis and care plan, I chose to go with interrupted family processes related to chronic mental illness of one or more family members, as evidenced by maladaptive communication patterns, role confusion, emotional distress. This can be seen, of course, throughout the household, where the use of substances to deal with the stressors, as well as just the lack of communication or the lack of head-on communication with dealing with the stressors can be seen. The goal for the family will be to report decreased stress levels and improve emotional well-being. Of course, some interventions include the assessment, of course, which is most important. You want to assess the family and see what the issues are. You want to provide education on mental health disorders. It seems that the family is really dealing with three types of mental health disorders: with substance abuse, with the autism and how to deal with that, as well as the chronic paranoid schizophrenia. Encourage participation in family therapy, support groups, and psychoeducation. Again, this goes back to dealing with the mental health disorders. Therapy, support groups, psychoeducation, and medication management is going to be the most important thing here. Assist family identifying stressors and developing positive problem solving strategies. Right now, the family has developed negative coping strategies with the use of substances and lack of communication and using laughter and jovialness to mask the symptoms that they need to be dealing with, but trying to identify those stressors and promote a positive problem solving strategy in order to tackle those issues. Provide emotional support and active listening to kind of see that goes along with the assessment to kind of see what's going on with the family, where their thought processes are, and assisting and develop a structured routines. Having the family know exactly what they're going to do, what they need to do, is very important in order to maintain that structure, that family structure. And of course, this comes from Robinson as well. Um, Okay, so for the Healthy People 2030 objective, I went with DHDO1, which is reduce anxiety and depression in family caregivers of people with disabilities. Those, of course, can be mental or physical disabilities. But in this case, it's going to be mental disabilities, but the same goal is going to apply to reduce anxiety and depression in family caregivers. Each family member has some type of mental disorder. Of course, this is causing a strain on the caregivers as well as the children as they navigate around their disorder and interactions with the family members. Negative actions taken can cause anxiety in all family members and may even lead to depression or helplessness due to overwhelming burden. And this, of course, comes from Healthy People 2030, which is a government website that lists goals for 2030. Okay, and for my references, of course, the Healthy People 2030 was a major reference in order to determine what that goal needs to be, as well as the book Robinson, which provided the Duval's 8 stages, as well as the nursing diagnosis. And thank you so much for listening to my presentation. I appreciate it. You have a wonderful day.